Africa's confirmed cases of COVID-19 have surpassed 1 million, according to a Reuters tally, as the disease begins to spread more rapidly through the continent. Its relative isolation had so far spared it the worst of the pandemic. Almost 22,000 of more than 1 million people infected have died, but the continent's infection rates may well be higher than reported. Experts say low levels of testing could be downplaying the numbers, and that some governments are too poverty-stricken or conflict-ridden to carry out widespread testing. Others may be reluctant to provide data that would risk exposing their struggling health systems. South Africa is the world's fifth worst hit nation and accounts for more than half of sub-Saharan Africa's cases. Public health services there are overwhelmed. There is a shortage of beds, protective gear and nurses. COVID-19 patients have sometimes had to be treated alongside others. One nurse, who declined to be named, said patients were sometimes left lying next to a corpse for hours because there weren't enough staff to remove it. The World Health Organization has warned that South Africa's experiences are a precursor for what is likely to happen across the continent. Many African countries rushed to impose quick lockdowns and shut their borders early, buying them precious time to prepare hospitals and set up testing machines. But governments have now mostly lifted lockdowns, mindful of the damage to their economies and the risk of widespread hunger. Some nations like Nigeria and Ethiopia still have travel restrictions in place. Rwandan police are arresting anyone in public without a face mask on. It's almost impossible to keep distance between people in Africa's poor, tightly packed urban areas. Hospitals outside African capitals are often poorly equipped with protective gear and necessities like oxygen, according to experts.